Thanks so much for joining me on the Slice of Healthcare podcast. How are you today?
I'm good. How are you doing?
I'm all right. Not bad. It's been a good week so far, so I'm looking forward to continuing to finish up on a strong note. What's new in your world?
A lot is going on. Feel like the fun part of being an early stage startup, you're balancing like 100 different things at once. But I think you're in the right place when you're having a ton of fun. So feeling good, not overly tired, which is a win.
Perfect. Yeah, I don't think non-entrepreneurs really grasp this concept. If you have to love this, because it beats you up a lot of days, right? And the highs are amazing, but there's definitely more lows in this than there is highs in the early stages. So celebrate the small wins too, right?
Totally. I often get asked how did you decide on June? How do you know it was the right idea? And I think the thing that I always come back to is that I always want to do it in my free time, even though I have very little of it. But if you find yourself working on a problem that gets you excited every single day and you can't stop thinking about it, that's probably the right thing to be pursuing.
Absolutely. Yeah. Well, I think we should dive right into the podcast. Why don't you tell the audience a little bit about yourself, and then we'll talk more about June.
Yeah, totally. So I'm Tina Beilinson, co-founder and CEO at June. I was born in Kazakhstan, and then my family actually then moved to Israel from Kazakhstan. We're Jewish, and we actually applied to get asylum into the U.S. When I was 6, we were granted asylum into the U.S., moved to Cleveland, Ohio from there. So saw a lot of different parts of the world by the time I was 6, and moved to a small suburb in Cleveland. And really one of the big things that impacted me in my life and my journey to becoming an entrepreneur is seeing both of my parents become entrepreneurs by necessity, because that was their way to make money and figure out how to make a path for themselves in the US. So my family is entrepreneurial, definitely by necessity, but really inspired by how they took that challenge and created their own destiny through entrepreneurship. And I always knew that was a path for me, even though they definitely did not want me to follow in their footsteps in that. So grew up in Cleveland, went to Denison University, studied economics. My mom wanted me to be a doctor always, but I quickly realized that was not the path for me. I loved economics and solving complex problems. And right out of school, I joined Deloitte in their management consulting practice. Realized that I wanted to solve more tangible problems and see the impact of the work that I was doing. And at the time it was about 2011. And I was just really excited by the startup ecosystem, especially in the e-commerce space. And so I was very lucky to join Warby Parker as one of their first 100 employees, and ended up staying there for about 6 years. So I saw the company go from a pure e-commerce company to have 85 stores. I saw the company grow to over 2,000 employees, and got to be part of a few different departments during my time. So jumped from e-commerce, then into retail, and then to strategy, and spent the last few years working on healthcare specific projects at Warby. So basically got all of my training there. I was very lucky to work very closely with Neil and Dave during my time there. And then ended up going to business school at HBS, where I met my 2 co-founders and started June.
Thank you for that intro. That was great. I think the question the whole audience is wondering right now is, do we get a discount to Warby Parker since we know you? No, I'm just kidding.
I wish I still had my discount. So if someone can hook me up, let me know.
Yeah, I know. I need to get some new glasses, and I've started looking because I really like their app for the virtual try on. I feel like they were one of the first to really roll that type of feature out too. Now it seems like everyone's trying to do that because it just makes a lot of sense, right? That's super cool.
Yeah.
Wow. No, that's a lot of, and Kazakhstan, isn't this, not trying to get silly here, but that's where Borat's from, right?
That is from where Borat's from, yeah.
Okay, that's
and I actually am a fan of the movies, but my parents are not. So
no, it's
we can have a cold conversation about that.
I know I think we need to have you back on just to talk about that. We'll do it separate. We'll create a whole separate podcast just to, that's, yeah, it's, well, I think people, they hear Borat, right? Like, and they hear the accent and everything like that. And then people hear that you're from Kazakhstan, and no, I mean, you obviously moved here very early too, right?
Yeah.
Yeah. No, that's funny. Oh, it's, that's really cool though. Really cool intro background. And so now you started June. Can we dive into like, you mentioned it a little bit, so we don't need to go into the full like why, how, what, but like, let's talk more of a description of what is June, who are your core like customers that you go after, like patients, and how are you helping them?
Yeah, totally. So June is a digital health platform. We offer expert support and small group support for expecting and new families. And really the core of June is to provide group-based care, which is really grounded in evidence and connection to drive meaningful outcomes during pregnancy, birth, and postpartum. And so when you join June, we collect a lot of information about you. So we get to know you, what your goals are, your health background, your history, and we pair you with a small group of 5 to 7 other women in the same stage and a doula or childbirth educator. And you go through the entire experience together. So everything is housed on our digital platform. You meet every 2 weeks virtually with your group and your coach. Every session has a specific topic, but really the focus of the conversation is a discussion to understand the choices that you're making and really have a conversation about these big decisions instead of being just fed information. On our app, we provide bite-sized pieces of information every day that's relevant to your stage so you can get all the facts. We have all of our curriculum developed in-house, and it's reviewed by our team of experts. And then we also have a chat feature in the app where you can chat your coach or group at any time. So you can continue the conversation after each session. And today we support families as early as 8 weeks in pregnancy. We find that to be super important in driving those birth outcomes, and as late as the first few months of postpartum, and actively expanding that curriculum as we speak.
So someone can sign up to use the platform even if they just had their child? Is that fair to say? Okay.
Yeah. So we have postpartum groups. So we have kind of a few key times that you can join. First is early pregnancy, as early as I mentioned as 8 weeks. We have sort of the 20 to 30 week mark where you're thinking about potentially taking a childbirth ed class. We basically cover everything you need to know about childbirth ed and so much more around how to prepare for postpartum, what to expect during that birth and delivery process. What are your feeding options? There's so much that goes into this. And then in postpartum, the first couple of weeks, as you can expect, can be focused really on feeding and sleeping. There is so much to think about there, but really, as soon as you feel like you're nailing that, there's so many other challenges that come your way. And so we're also really focused on making sure that you feel mentally healthy. And so we focus a lot on how you're doing, making sure you have expert resources and support, and also to have a community of other women that are going through the same thing that you can talk to.
Perfect. Yeah, well, it's pretty interesting. I'm curious as to what type of signups do you see the most of? Are you seeing more people that like are getting started as early as possible? Or are you seeing more that are signing up for postpartum?
Yeah, so today we see most people signing up during that like 20 to 30 week stage, because today everyone knows who's pregnant that they need to take that childbirth education class. The childbirth education experience in the US today is really archaic. So most people, well, before COVID, most people will go into the basement of their hospital, spend a few $100s on that experience. It'll be 8 hours over their precious weekend. And it's just not that much fun. And so we're really rethinking that whole experience where you not only get that information, but you also get the convenience of it being in your own home, but you still get that community that comes with meeting other families in the same stage. But the difference is that you meet those same families every 2 weeks. You develop really close connections, and then you have this built-in support system that's ready for you in postpartum. And so we've actually had families that have been with us for almost 11 months now into postpartum because they developed such amazing relationships with each other that they basically talk about everything and anything. And it's almost become their kind of precious time away from everything else that's going on in their life to kind of connect with these women that are all over the country.
Interesting. What are some of the things you're most looking forward to as we kind of roll into 2021?
Yeah, so there's so much that is happening and we're looking forward to, but I'll touch on a couple of things. So the first is we're launching a pilot in partnership with Vituity. I know you had Andrew on recently at a health system in Chicago. We're actually going to be offering this pilot to pregnant women that come into the ER for a variety of reasons, whether they're experiencing pain or bleeding. And June is going to be offered as a resource to them after they leave the hospital. And so the whole purpose is that, you know, when you're going into the emergency room, obviously it's a very traumatic experience, especially being pregnant. And currently you're sent away with really a lack of resources. And so June is going to be offered to these women. And the hope is that it's going to prevent second and third time visits to the emergency room. So unless they're absolutely necessary, of course. But we're going to provide them education, support system, and access to a dedicated coach that's there for them anytime they need. So really excited about that. And it's also going to be an incredibly impactful pilot for us because we're going to be tracking outcomes as part of the June intervention. The second thing that we're really focused on right now is how to become experts in this group care model. And so group care has existed for decades. We're definitely not reinventing it. We're thinking about how we can expand the power of group care through the digital setting. And so there's so many incredible ways that groups can actually drive better outcomes. So for example, group prenatal care has existed in an in-person setting for decades. It's actually been shown to reduce preterm births by 37% compared to one-on-one care. And so we're trying to replicate that in an even bigger way through digitally. So for example, thinking about how you group people based on condition, or thinking about how you group people that have English as a second language, or grouping people together that are second-time parents or having multiples. There's so many amazing ways that you can group people together to drive those meaningful connections and keep people coming back and adhering to their plan. So we're going to be doing a lot of testing there this coming year and thinking about the different avenues of growth for June. Yeah,
you're going to be very busy. So that sounds like a lot of fun though. And doing those tests are, it's how you continue to learn, how you continue to enhance the platform and the overall experience, right, for the patients. So that'll be awesome. And just for the audience too, like the plan is for us to have you and other members of your team on the podcast over the course of the year and really develop some good content together. So this is really your intro to get to know you, the company, and kind of what you're excited about. And then we'll go into some of the other issues and areas of focus for your business in particular on other episodes of the podcast. So I'm excited for that.
Yeah, us too. We love that.
Perfect. Well, again, thank you so much for joining me on the podcast today. Excited to stay in touch, and future collaborations are on the horizon.
Amazing. Well, thank you so much for having me. This has been awesome and looking forward to the next one.
Thanks.